looking after your back and returning to activity and exercise after you have had your baby, from the Pelvic Health Physiotherapy team. After any type of delivery, it is sensible and recommended to slowly and gradually return to your pre-pregnancy level of exercise and activity. It takes several months for your body to heal and to regain strength, particularly in your abdominal and pelvic floor muscles that can be greatly affected during pregnancy and your delivery. It is important to look after your back after you have had a baby. Your abdominal muscles are likely to be weaker at this time, and they have a big part to play in supporting your spine and pelvis. Your joints are more flexible due to an increased level of hormones, and babies require a lot of lifting, carrying and repetitive activities that can put strain through your body. When feeding, check that your back is supported. Check that your feet are uncrossed and on the floor or a stool. Have your baby and the supporting arm rested on a pillow. Check that both your shoulders are relaxed and comfortable. If you are uncomfortable with feeding, please consult your midwife at any time. When changing your baby's nappy, try not to stoop. Use a surface which is level with your waist. If changing your baby at a lower level or on the floor, try to kneel to protect your back. If no one is able to assist you with heavy day-to-day activities, such as lifting the car seat or the pram, then when doing these activities, try to focus on squeezing up your pelvic floor muscles whilst you do the activity to help give more support to these muscles. What types of exercise are safe for me to do in the first 3 months after having my baby? It is important to listen to your body. Start by just slowly increasing your level and amount of walking. Maybe on the first few initial trips out of your house, ask for somebody else to push the pram for you. For the first few months after birth, it is advisable to choose low impact forms of exercise and avoid anything that causes you to strain. Good examples of low impact exercise can be walking, postnatal Pilates or yoga, swimming once your bleeding has stopped, or performing bodyweight exercises at home such as step-ups or squats. When possible, try to avoid heavy lifting activities. When can I return to running or other high impact exercises after having my baby? High impact exercise such as running or jumping activities should not be considered until at least 3 to 6 months after having your baby. This is because these activities place a lot of stress through the tissues, ligaments and joints that are recovering after pregnancy and birth. Before returning to running, it is advisable to have a pelvic floor assessment to be able to help you establish how well the pelvic floor muscles are functioning after your pregnancy and delivery. A specialist pelvic health physiotherapist is capable to perform internal examinations to tell you how well these muscles are working and to be able to shape an individualised exercise program for you to help your pelvic floor recover and support you in the best way. Before returning to activities such as running, we would highly encourage a slow, gradual, progressive return to this level of exercise. Please see the following slide for further information, which is taken from the postnatal return to running guidelines. When it is safe to return to running, it is advisable to use apps for guidance such as the Couch to 5K, which helps you progress slowly and sensibly to returning to your pre-pregnancy level of exercise. It is also not recommended to return to high impact forms of exercise such as running or HIIT exercises including jumping when you are experiencing symptoms of pelvic floor dysfunction. These symptoms could include urgency with your bladder or bowel, incontinence or pelvic organ prolapse, which may give you symptoms such as vaginal heaviness or dragging, or the sensation of a lump within the vagina. It is also important to consider that you may well be getting less sleep than your body is usually used to, and to not underestimate the impact that this may have on your body. It may well be worth considering looking at new clothing, such as having a new sports bra fitted, and also to consider looking at getting your feet remeasured and to treat yourself to a new pair of trainers, as our feet can tend to change shape and size quite considerably during pregnancy. Thank you for listening. We hope this information has been a useful guide to you on returning to activities and exercise after having your baby. We do recognise that everybody is different and that every pregnancy and delivery is completely individual to you. Therefore, use this as a guide and do seek help from a healthcare professional for your individual situation and advice.
Thank you for watching the video. We hope that you found the information useful. Now we need just a few more minutes of your time, if possible, please. We as a team have put together a little survey to find out some more information from you to see if we can improve the service for future mums. If you click on the link down below in the comments underneath this video, it will take you through to the Survey Monkey. Thank you very much for your time.